Well, you know, I don't guess doesn't matter where you go, the medical industry will always be vital. I mean, you can't stop disease processes, you can't stop people from getting ill, you can't stop accidents, so you're going to always have the necessity for medical treatment and medical therapy. So, I mean, it's always been vital. My dad was practicing since 1920s, and doctors have always been here, and it's always been a big part of the parish taking care of them. And certainly, if you look at the growth of hospitals, we had only one hospital when I came, and now there's two big hospitals which have every facility known to medicine. I think that it tells you the importance of medical practice and medical care in our community. How did it shape? Well, it was pretty strange how it's shaped now. When I first started practicing, they didn't have Medicare, they didn't have third-party insurance to pay all your bills. They had patients that walked into your office and paid a pretty much reasonable, cheap price to see a doctor and get treated. Today, it's kind of all changed. Somebody else is paying the bills, and I think that has led a big reason why there's such an increased cost in the cost of medicines, because somebody else is paying the bills, and the patients are demanding a lot more since they don't have to pay out of pocket for it. So you're getting a lot more testing done, a lot more work done to get a patient feel comfortable in their disease process. So I think to go from personal pay to third-party pay has been a big difference in what has cost the structure of payments to exceed what they are today. When I came to Houma, we had hardly any technology. There was no such thing as a CAT scan. There was no such thing as an MRI. There was no ultrasound. So, I mean, those are all things that have come since I've been in practice since 1970. Electrocardiograms have kind of changed to angiograms and things that have really improved the practice of medicine. The diagnostics of medicine now are really extremely excellent. And every modality is available in Houma. And none of these were available when I first came. My dad didn't have anything to practice medicine. It was all touch the patient, feel the patient, listen to the patient, and examine the patient, and come up with a diagnosis and treatment. Today, you have a lot of ancillary health. You have plenty of x-rays, you have CAT scans, you have all these studies, laboratory availability that makes the practice of medicine more difficult, but a lot improved for the patient care aspect. The challenges for the industry, there's plenty of doctors. There's plenty of doctors and plenty of choices, and I do notice that patients themselves really are not that particularly keen on who their doctor is. I mean, doctors now seem to be doctors, so they'll take whoever takes care of them, and it's not near as I'm only going to see one doctor and I'm only going to see him. You know, when the cost of medicine all of a sudden went up, that's when the copay became the most important thing in the care of a patient. So I think if we look at that now, the availability is there. I think all the physicians are excellent. I think the people they're putting out is excellent. We have a lot of ancillary people treating diseases now, nurse practitioners, physician assistants, and it seems like there's just a lot more availability, and the patients certainly are accepting the care that they're getting from all these other modalities. And my dad, when he started in the 1920s, he worked behind my uncle's drugstore, Haydell's drugstore, over there by the church, and they had a ice cream place there. We all loved going there for the ice cream and sodas, but he worked in the back. My uncle owned the drugstore, and of course he owned the Houma baseball team that we all got to go watch the minor league baseball play. And then he moved from behind the drugstore to where we presently are on Barra Street, and that building was probably in the 1930s, and he practiced there from 1930s until all of his sons joined him in practice until he passed away. So our little practice was one little building that now has 6 additions onto it now, and it just got devastated in the hurricane, so we're going to put it all back together again. So like I said, my dad started with nothing. no particularly great tools of diagnostic ability except his. And then as we all came back, more and more things came available for us to practice medicine. We tried to add all that to our practice as it is now. So, and Coast Homa, from the time I came, has really grown in all the number of specialties that have come. They were just kind of had OBGYN, a few orthos, and a couple of surgeons, and now we really have every specialty. We have 2 big hospitals that can take care of almost anything. And we're so close to New Orleans where they have really major treatment facilities that can take care of any kind of catastrophic illnesses that we have. So I think medicine in general has really grown, has really become a popular field. It's got as many female doctors as they have male doctors now, and I think the future is very bright for anyone that chooses medicine, and I think it's just a wonderful field. I'd love to talk about that. I got my daddy's charge cards, and he would pick them up. And when he first started practicing back in the 30s, it was like 25 cents, 50 cents for an office visit, or ice chest of shrimp, or a couple of crabs, or whatever. And then we kind of progressed, and he kind of increased in his costs. When I came to Homa, an office visit was $5. And when we delivered a baby, I would take care of the mother for the entire 9 months. We'd see her every month, and then every week in the last week, and if she'd have a boy, we'd take care of the baby in the nursery and do the circumcision. The entire price of that from day 1 till delivery and circumcision was $125. And we did that for a long time before third-party pay came in, and certainly we increased that. But I don't think we ever got much higher until we stopped delivering babies, much higher than $300 or $400 for a delivery. So prices have really changed. So all of women know that they don't pay $125 or $300. The hospital bills were very cheap back then, and when you had a baby or you were in the hospital, you could stay in the hospital as long as you want. They didn't tell you had to be out in 24 hours. Yeah. So if you wanted to have your baby stay in the nursery for 4 or 5 days and you wanted to recuperate, you could stay 4 or 5 days. We used to be able to admit a patient to the hospital for a complete diagnostic workup. Put them in on a Monday, they'd have a barometer, upper GI, x-rays, gallbladders, all that stuff done, be finished by Tuesday, and they'd go home, but everything was done in the hospital. Can't do that anymore. The insurance companies put great restrictions on what we can and cannot do. Medication-wise, every medicine used to just have a name. They didn't have generic names when I started. Now, gigantic generic names. I have trouble between the brand name and generic name. I may know one way or the other way, and I have to look them up a lot of times. But it's a lot different between brand and generic. The cost is a lot different between both of them. And, it's just one of those things that's happened in medicine. So I do think generics have helped the people that have to pay for medicine, although it really makes it tough on some of the patients because it's the good new medicines. If you're on Medicare, you really have a tough time getting the expensive, good, brand new medication. So we have to do the best we can for the patient and try to treat them in the affordable means that they can handle. And that's always a challenge, but we try to work through it and do the best that we can for the patient. And that's a pretty easy question on the economical impact. You can just look and see. Probably the hospital has the largest employment, I think, in Terrebonne Parish. If you add the hospital and Chabert, I mean, that is an awful lot of employees. And that's an awful lot of insurance, that's an awful lot of bills, there's an awful lot of payments, it's an awful lot of income, it's an awful lot of taxes that's paying. So the medical industry has grown from that little hospital that we used to have to what it is today. I think we can see the number of people that are working in the industry has really grown, and it's gotten to be really big. So for the parish itself and the economics that it brings as far as taxes and income, I think it's tremendous. I think the future of Terrebonne Parish itself is, there's a lot of ifs, ands, or buts about going on in the future. And if you read about the oil industry and the seafood industry and the water recession and the sinking, and there's just so many issues that we have to look forward to the future. But as long as we have people living, and as long as we have people here, the medical industry is going to continue to be, I think, a very big part of Terrebonne Parish, both financially, economically, and in the life-saving endeavors that it continues to do today. Actually, another thing that's really interesting is that record keeping and documentation. There was no documentation back in the days when my daddy practiced. His cards, all they showed was the price of the office visit. How he remembered what every patient has is beyond me. They had no diagnosis, no treatment, it just had the date and the cost. Now, as we came, when we first started, my brothers and all practiced before I got here. I was the last one here. When I came, we did put a diagnosis and treatment, but we did not have 7 or 8 pages of documentation on each visit. So we were able to see a lot more patients because we didn't have emergency room physicians, we didn't have shop air, we didn't have any other facilities, no urgent cares. So all the patients in Houma would come to somebody's office that would see them, and they would usually wait outside because they couldn't all fit inside, and you'd see them as they came. It started back in the 70s with no appointments, but then we tried to space the patients out so they didn't all come at once. So we started having appointments, and then we'd have work-in. So the number of patients we saw was unbelievable how many, because there was no emergency room to go to, no urgent care to go to, so we saw everything. And they would just line up, and we'd see them as fast as we could. And there were no big giant documentation records that we had to keep to make insurance companies and Medicare and everybody else that needs records happy. We just made us and our patients happy, we thought. Oh, the total cost from first visit to delivery to prenatal care, taking care of the baby in the nursery, doing a circumcision on the baby, and then seeing the mother at 6 weeks, seeing the baby for the 4 weeks checkup, and the mother at 6 weeks was $125. So it was all of that. But just the last unique thing that I want to say, that when I came to Houma, I was the youngest practicing physician. While y'all talk to me right now, I am the oldest practicing physician. If that's a unique thing, that really tells that time goes by really fast. So make sure you enjoy everything you do right now, because time really flies.